So should new doctors, if they're not currently using an amniotic patch or using this in their practice, why should they add it to their practice to help their patients? And then why should they join EyeCyte?
Why should you join, let's say, amniotic patch? Why should, if you're not using amniotic patches regularly in your practice, why should you? because it's the newest, best medical treatment that exists, and patients have a right to get the best thing that's available. And we don't want to, as doctors, not even tell them about what was available and just throw on some inferior medication, and then they get permanent corneal scarring, they get chronic pain, they get all these things, and there's a level of liability there if you withheld the information that they could have been treated by a more state-of-the-art amniotic patch that's available, that's covered by insurance. Even if it's not, if it exists and it does, and it's FDA approved, and there's 10 different vendors, you can get different types from. This is easy, but it's covered by people's insurance. This is standardized, well-established, thousands of journal articles, treatment method that's really effective, really helpful, better than steroids. It heals things. I had a diabetic patient with a neurotrophic ulcer that wasn't healing, and we threw on amnion patch, and he healed 50%. It is just rapid healing. And steroids would have given him a viral infection. It'd have been crazy. But I have other people with chronic just ocular surface inflammation. There's no ulcers, just inflamed, and they're always inflamed, and we're always throwing steroids on it and lubricant, all these, and then they're just kind of dragging. They're just living their life inflamed, and we're just kind of piddling around the issue. And you start treating them with some real quality amnion patches, and they get better, and it's chronic healing. It lasts, and that's why I added it to my practice. One, because the patients deserve the fix, they deserve the care, they deserve the state-of-the-art technology because it exists, their insurance covers it, and I need to make them aware of it and offer to give it to them if it help them. And then two, the insurance covers it, and the reimbursement rate is really good. The amnions, there's enough companies making them that there's a really good margin on amnion cells, on amnion patches, and it's a really big profit maker for your practice, and it's a really great help for your patients with chronic ocular surface inflammation, or with even acute issues, little scratches that threaten scarring, that threaten chronic epithelial erosion. This is any inflammation on the front of the eye can be treated with an amnion patch, and it's going to be helpful for the patient, the best possible existing care, and the most profitable for you. It's just a solid win for them and for you.